As a kid, I would go shopping with my mom, and inevitably I'd find a toy or a piece of candy I wanted, and I'd ask her to buy it for me. And she'd always say the same thing. She'd say, "Caroline, you don't need that." You see, my mom grew up in a middle-class family in Baltimore, the daughter of a factory engineer, and she knew very clearly the difference between needs and wants. Needs were things that were essential, things that you budgeted and planned for. Wants were optional and not to be frivolously purchased. For decades, the senior housing industry has catered to the business of wants. Building on lessons from the hospitality industry, you've created wonderful environments for your seniors, offering them comfort, ease, and fun. Who doesn't love a good bocce game? I certainly do. You've invested in your physical plants and your social programming, and it has worked. You all have buildings filled with seniors who have chosen your communities for a sense of purpose and lifestyle that they desire. And yet, when we conduct surveys, 88% of Americans say that they want to age in place in their homes. Only 10% indicate that they're interested in senior housing. Now, you all know me as the author of the Forgotten Middle study, and I know you're good students of that study. So you know that today, most middle-income adults cannot easily afford the assisted living properties available to them. These individuals are not going to stretch their budgets and invest every penny that they've saved for lifestyle, for community, and definitely not for bocce ball. Meanwhile, the healthcare industry, my industry, has long catered only narrowly to the business of medical need, at the exclusion of customer experience, convenience, and service. And so, this dichotomy persists. We have a healthcare industry focused specifically on medical need, and a housing industry catering to what people want. But what this dichotomy ignores is that as we age, these two areas converge. And what we will need and want more than anything is to be safe, to be well, to be cared for, not to be a burden on our families, and to have good, easy access to our medical care teams. So let me tell you a story. It's one that you will all understand very well. This is my house here in Chicago. It's an 1891 Queen Anne Victorian, and I love it. My kids play in the backyard. They meet their friends down the block at the park. We sheltered there during COVID. We have a community. We go to the farmer's market. We see our friends and neighbors. I want to live here forever. Or so I thought. Until earlier this year, when at the end of a family vacation, I had a catastrophic skiing accident and shattered all the bones in my lower leg. I live today and forevermore with 2 very large stainless steel plates and 22 screws, and I do indeed set off the metal detector every time I go through the TSA checkpoint. I quickly reprioritized my life as I learned to navigate the world on a knee scooter because I could not walk for 6 months. And in that time, all of my priorities shifted. What I needed was someone to help feed and care for my family, to help bathe and dress me, to help me get to and from my many medical appointments, and to help me with my daily physical therapy. What I wanted more than anything was to be cared for in a time when I was not well and could not care for myself and my family. And so this is what it's going to take to get people to make a different decision, to get those 88% of people to understand that they need to leave their homes. It's going to take a change in priorities. And it is going to take them understanding that what they want is also what they need. And you all already know this, because you already see this in your communities today. We have, for years, talked about the acuity creep within each of your properties. You're already taking care of people who are older and frailer than those who are living out in the general community. Your residents are twice as likely to be hospitalized. Many of them need assistance with activities of daily living, and many of them suffer from cognitive impairment. These are the health and medical needs that you are dealing with in your communities every day, and so we should embrace them. Meanwhile, for the folks that want to live in their community, when we ask them, is your community well set up to support your needs? Only 1 in 3 believe that their neighborhood would do a good job taking care of them while they age in place. They don't know if they have access to well visit checks, to grocery delivery, to virtual care services. The rates of confidence are even lower in rural communities, among low and middle income individuals, and among people of color. 1 in 5 older adults does not have a trusted person who lives within an hour away. So while people think that they want to age at home, our communities are often not set up to meet those needs. But you can be. And so what is it going to take? What is it going to take to get more people to come out of their homes and into your communities? It is going to take thoughtful and serious integration of housing and healthcare in ways that go far beyond what you're doing today. Because while you are effectively serving a high-income population, you know from our work that the middle-income group is about to double in size, from 8 million middle-income seniors today to 16 million at the end of the decade. And while many of them cannot easily afford assisted living, if they sell their homes or get help from their family members, many of them could. But they are not going to do it for community, they're not going to do it for a sense of purpose, and they are definitely not going to do it for bocce ball. They're going to do it because they need it, and because over time, their priorities will shift, whether it is gradually or suddenly like they did for me. So you say, what does this mean? Well, I'll tell you, it does not just mean having a van service to bring people to their traditional medical care providers. This means a holistic rethink of how housing and healthcare can be combined in a truly integrated and holistic fashion. And like all things in healthcare, that starts with primary care. So you can think about whether you could bring an on-site nurse into your community. Many communities have. And those nurses can be a conduit between your residents and their core medical care teams, your residents and their family. They can help manage pharmaceutical needs, as well as other services. We have healthcare providers, risk-based healthcare providers that are investing in sending folks out into the community. Companies like Concerto Care and Landmark regularly send caregivers into people's homes to deliver them the primary care or more complex care services they need. In the era of workforce shortages, that is a very challenging business model, but you have the scale to deliver those services in an efficient way that serves both the residents and the healthcare system. Companies like CVS are building retail clinics around our communities. Why not co-locate one in your community as a first point of medical service for your residents and others who live nearby? Many of you have also begun to think about ways to integrate nursing and personal care services in your properties to get over the hump of people needing to contract for minimum numbers of 4 to 6 hours of service, but to deliver folks exactly what they need in the time increments that they need them. In healthcare, we're very excited about virtual and digital care. We have MA plans and health providers delivering services virtually via telehealth, as well as other digital solutions. You need to be a partner to your residents to help them engage in those tools. Help them with their remote patient monitoring for their diabetes or their cardiac care. Help them engage with telehealth services to improve their behavioral health and seek the treatment that they need. Help them conduct virtual physical therapy and save them the trip to the physical therapist. Now, I know what you're thinking. How on earth are we going to pay for this? Well, let me tell you, in the healthcare world, this is big business. Last year alone, Medicare Advantage plans spent $3 billion delivering in-home assessments for their members. This is not care or treatment. These are simply sending people into members' homes to help record all of their healthcare needs, connect them with providers, and support the plan's risk adjustment, which is how they generate revenue. It also supports the plan's quality improvement programs, which is how they get star ratings, which generate bonus payments. There's money to be had in Medicare Advantage, and what every Medicare Advantage plan says is we want eyes on our members. That's why we're sending people to your homes. You don't just have eyes on their members, you live with their members. Invite these partners into your communities and find creative ways to work with them to both help them achieve their healthcare goals and your residents achieve their wellness goals. Risk-based providers are the fastest growing segment in all of healthcare. They are similarly contracting with a variety of community benefits organizations, similarly trying to support all of the needs of their patient population outside of that clinician's office. You can be their partners, and in doing so, you can tap into the resources that the healthcare community has to offer in a variety of risk-sharing arrangements. So please, take this seriously. As a person who suffered a tremendous mobility limitation, I know that my home couldn't serve me in that scenario. And I also know that, in fact, home is not the house you live in. It's the place that you live well. It's the place you're cared for, where you're safe, and where your health and well-being can be served fully. And I urge you to take this seriously and think about full, meaningful integration of healthcare services into your housing. Because at the end of the day, that is what is going to serve your current residents. It's what's going to attract new middle-income residents into your properties. And it's what's going to create a valuable business proposition for you to offer to the healthcare community. Because at the end of the day, for older adults, healthcare is not just what they need, it's also what they want. And that makes all the difference.